I would like to welcome you to our training session today. My name is Virginia Savarese. I'm a clinical educator here at our organization. And as field nurses beginning to work, taking care of our pediatric clients in their homes, one of the procedures that you're going to be frequently requested to do is to change out your client's low profile gastrostomy tube. There's two reasons that the tube needs to be changed. They frequently become dislodged, and if that would occur, you would need to replace it, or they are routinely changed on most of our clients every 3 months. So I'm going to be providing a demonstration step by step of removing and replacing a low profile gastrostomy tube for you today. I'll go through the steps one time, and then I'm going to repeat the demonstration a little bit faster the second time around. And then I'm going to be giving you time for questions and answers and also some practice time. My objective for today is that by the end of our session today, that you will all feel comfortable being able to replace a gastrostomy tube in your pediatric client in the home if that procedure is required. So one of the first things that you're going to do is that you need to verify your physician's orders before you even get started to make sure that you are replacing the tube when it needs to be replaced and that you're replacing it with the proper size tube. The other thing that you're going to need to do is make sure that you have the equipment that you need. Make sure that you have adequate lighting. So one of the first things you're going to do is most of your clients in their home will already have a spare low profile gastrostomy tube there that we typically have them keep in their home as a backup. So based on your physician's orders, you want to be able to verify that you have the proper equipment in the home. And your Mickey, that's the brand that we're going to be using today, it's one that's frequently used in home care, will have the size, the French, and the sonometer of the tube. And so you need to look at your physician's orders and make sure that you are verifying that the tube that you're going to be using is the correct width and length. And you're also going to verify your expiration date. They all have an expiration date on them to make sure that you're using one that has a current date on it. So when you get your gastrostomy tube kit, you're going to, and you verified everything, you're going to open it up and you're going to make sure that all of the supplies that you need are included in your kit. So inside your kit, you are going to find water-soluble lubricant, a 35 cc cath tip syringe, a 10 cc slip tip syringe, gauze, and then of course your tube is going to be here. And again, written on your tube right here is the size and so your depth and your width of your tube, and you just want to make sure that the tube that's actually in the package matches the measurements of the tube on the outside of the wrapper. So what you're going to do first is that I need you to make sure that you wash your hands. And then the first thing we're going to do is take the G-tube that's in the new kit, and we're going to verify that your balloon is a usable balloon. So the standard practice is that this balloon is inflated with 5 milliliters of water. And you have a port on the side of your tube that is for your balloon. So what you're going to do is you're going to draw up 5 cc's of water, and you're going to insert the slip tip syringe into that port, and you're going to inflate your balloon. And what you're looking for here is to make sure that your balloon is symmetrical and that it doesn't have any leaks. And once you've verified that, you're going to remove the water and set this syringe with the 5 mLs of water aside and just put your tube back into your packet here. Okay, now we have everything ready that we need to put a new tube in. So the next thing that we're going to do is we're going to remove the old tube from your client. So now it's time to remove the old tube. The first thing that we're going to do is put on a pair of gloves. And then we are going to need to remove the water from the balloon So what we're going to do is we're going to take our syringe and we're going to, an empty syringe, and we're going to attach it to the balloon port, and we're going to pull back on the plunger and gently and remove the water. And you'll know when you have everything out because your plunger will start to meet resistance. And then we are going to gently just pull on the tube, and we're going to remove it. You're going to inspect your old tube when you remove it to make sure that the tube itself is intact, and to be able to document if there was anything unusual about the appearance of the tube. And this tube can be discarded. And then we're going to go into our packet of our new tube, and we're going to remove the tube, again, that we've already verified is the same size, and you're going to put a little bit of water-soluble lubricant on your tube. And just be aware that you may not use petroleum jelly or any kind of oil on your tube. So once you have your lubricant on your tube, you are going to gently insert the tip of the tube into the stoma, and you're going to guide it in a nice gentle downward motion until it's sitting flat against the skin. And then you're going to get your syringe with your 5 mLs of water, and you're going to again put the slip tip end of the syringe on to the balloon port, and you're going to insert the water so that you're inflating the balloon. You're removing your syringe, and when you're finished, you can just kind of tug on this just a tiny bit to pull up to feel that it's secure and to bring the balloon up against the stomach wall. And then when you're finished, now your tube's in, you just need to verify placement of your tube. And you can do that one of 2 ways. You can do that by aspirating or auscultating. So there's an extension in your kit that goes onto the tube, and what you're going to do is attach this extension to your tube, and then with a 35cc syringe that I showed you earlier, you're going to put that onto the end of the tube, and you're going to pull back on the plunger to withdraw stomach contents. If you get stomach contents into the syringe, that proves that the G-tube is in the stomach. The other option that you have is that you can put air into the syringe, and you can put it on the end of the tubing, and then with your stethoscope you can listen over their stomach, and you inject the air, and you're going to get a gurgling sound or a popping sound as the air goes into their stomach, and that again will confirm proper placement of your tube. And that's the steps for how to change a low profile gastrostomy tube. And now I will open it up for anyone that has any questions. And then after we've gotten the questions answered, I'm going to again go through the steps one more time for you. And then, as I said before, we'll allow some time for practice. So does anyone have any questions?